Let's hit it.
Well, hi everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
All right, here we go. What you think about, you will bring about. Commit to change. We will.
Hi everyone, I'm Lori LeBay with Alzheimer Speaks Radio, and today we're going to have a conversation about COVID-19. We've been doing this weekly and getting just various opinions and insights as to how people are coping and how they're adjusting, and wrapping up also with the good that they're seeing coming from all of this change that's impact us. So for those of you that don't know me, my mom had dementia for 30 years, and so that changed my life, and that's why I created Alzheimer Speaks, which is an advocacy and media-based platforms that I work with, and I've been doing that about 10 years. And I'm going to let each of our guests introduce themselves, so I'm going to start with Barbara Lee.
Well, my name is Barbara Lee Friedman, but I go by Barbara Lee, and I am a musician. And I have a background in music and psychology and history and a master's degree in counseling. But really, my life's work has been therapeutic music programs for the elderly.
Okay, great. Thank you. And Tree?
Hi, my name is Trescia Dunn, and what can I say about myself? I guess all my life I've had a variety of interests, and I can see they've all evolved around people and around love and the power of love. And even I worked with Whole Foods for many years with food, and I educated people. And what that boiled down to was really love of the earth and love of food and its sustenance and everything. So I'm glad to be here today to learn.
Great, thank you. And Cathy?
I am Cathy Braxton. I am a co-founder of Dementia Raw. It's a business we've been running for about 6 years now. I've been in the elder care, the older adult population, working specifically with Alzheimer's and dementia patients and families and caregivers for over 25 years. I have my master's in health psychology, and my passion has always been to work with the population who is living with dementia, because I personally have my own personal experience with it and find that the relationship I can develop with those people and the caregivers is something that's very unique, that I can help anybody to create a better connection with people that they love. So I'm really happy to be here. Thank you.
Wonderful. Well, Cathy, I'm going to start with you and just ask, I always ask all of our guests if they've been personally touched by dementia in their circle of friends or family or themselves. And so if you wouldn't mind giving people a little bit more background.
Yeah, so I was in a rollover car accident when I was 18. And although I didn't really suffer many physical injuries, it started to become pretty clear after about 2 or 3 years that my memory was starting to fail, and I was having a difficult time remembering dates and places, names. There were chunks of time that I was missing. Went to go see a neurologist, and I've been being followed by a neurologist ever since. I have mild cognitive impairment. It does seem to be getting slightly worse every year. If I keep a good routine and I keep a nice schedule and I write every single thing down, I do okay. But I have big chunks of time that are missing. I have difficulty recalling names, dates, faces. My short-term memory is very, very, very bad. So we have a giant chalkboard in the kitchen where everybody writes things down to help me remember. And I've really had to help my family start to realize what it's like to live with somebody who has cognitive impairment, because when I have to say several times, I don't remember that at all, I've had to teach my family to understand that it isn't a personal thing. I'm not choosing not to remember it. I'm not choosing to be rude or disrespectful or hurt anyone's feelings because I don't remember something that we did together a couple weeks ago. I just need as many reminders as possible.
Wonderful. Thank you. And Tree.
Thank you for sharing that. Very personal, Cathy. Well, actually, when I think about it, I know when I was younger, before the term Alzheimer's came in, yes, some of, the older, my great aunts would have what they'd say dementia. But I guess it was not been real severe because I didn't, I just noticed that they weren't quite the same. Maybe I was too young. As I got older, my sister's mother-in-law, who was a very much loved woman, developed Alzheimer's. And I learned a lot about Alzheimer's through her and through my family in Denver. And I think Trudy lived about 15 or 16 years with Alzheimer. And most recently, in the last year, I've been doing a little companionship, with a elder at a nursing home or a memory care center. And it's got probably about 20, 22 people who have dementia or Alzheimer's, and I can see its impact on some is worse than others. And I don't know how to say. I'm learning a lot about it, and I'm sad that the people have lost so much. But their spirits, it just feels so big to me still. On every level, they just, like, I go in and I get so happy being around them. I'm so happy, and we have so much fun. I just think it's a heart connection or something. And even a couple of them that never spoke and didn't even seem to interact with the environment, I'd keep talking to them. And maybe a few months later, all of a sudden, out of nowhere, boom, they're talking to me. And I just always kind of felt it was there in the heart anyway, even if there wasn't an affect. So I guess that's my experience. It's very limited from, Lori, what you've done.
Okay, thank you. Barbara Lee, how about you?
Well, my experience with people I know is very limited as far as people with Alzheimer's. It's interesting, right now my mom, or actually stepmom, Marge, is 98 years old and has started with memory loss, but it's not, I wouldn't say Alzheimer's, but beginning memory loss, beginning at 98 years old. I feel so lucky. I had a friend of mine that I became the caregiver for her mother who had Alzheimer's. So that was a real eye-opener for me to really, on a weekly basis, daily basis, be with somebody who had Alzheimer's. Let's see. And then really, which I'll talk about later, is the connection has been through my work. And that's been, believe it or not, 55 years of my 69. So I'll talk about that a little bit more, but as far as personally, no.
Okay, great. Well, I think what I'm going to do is, Barbara, since we've got you off mute anyways, I'm going to go to you for this first question in terms of talking about how COVID-19 has affected you personally and with your business and your clients.
Okay, well, I go to independent living, assisted living, memory care, hospital, hospice, adult day programs. I have about 25 to 30 programs I do a month. And they're all stopped now. I see nothing since March 9th. So not only is it hard financially for me, because that's really a huge loss of my income, but I really miss these folks. Like you were saying, Tree, some people don't know their name anymore, but when I sing a song, because my thing is therapeutic music, so when I sing a song that they remember from 1940, they sing along, they know the words. So it really is remarkable to me, because when I also go to some of the sites that I go to, the feeling that I get to connect with people with Alzheimer's is so special. The smiles, the dancing, the movement, the laughter. Now I tell jokes too. I don't just sing. I like to tell jokes because people not only like to sing, people like to laugh. And some people may not understand the joke, but they know it's a joke. They know to laugh. It's really fabulous, absolutely fabulous. I have some people who their only form of communication now is ba 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 ba. They don't say their names. They don't know who they are, who their family is. But when I sing Daisy Daisy from 1892, if they're old enough, if they're in their 90s, they sing along. You wouldn't believe it. You wouldn't believe that the people that come back. In fact, I did a music program for Lori's mother at Maplewood Care Center 11 years ago. And she just came alive and she started singing out of the blue. She was singing. At first, her eyes were closed, her head was down. I sang Doodly Doo. Please, please, for me, that sweet melody called Doodly Doo. And she is singing along and laughing. I'm telling you, the spirit of people with Alzheimer's is still there.
Very, very much so. And I remember I had not ever heard that song before you played it. And now it's one of my favorites. And we have we've made up probably 9, I think, different clips of you singing to Mom that are on YouTube. And some of them have like 65,000 hits. I mean, it's just amazing. I've walked in on conferences and my mom is on the screen and someone else is using that as an example.
Oh my gosh.
And then they scurry back to me. Oh, I'm so sorry. I didn't know. I should have asked. And I'm like, no, it's public domain. Use it, leverage it any way you can to get people to understand. So you, I imagine, can't go in personally anymore. So how are you adapting to COVID with your business?
Well, this famous Lori LeBay called me up last week, about at the beginning of a few weeks ago, and said, geez, I need something for my radio show. How would you like to do a Zoom sing-along? And it's like, sign me up. Sign me up. So we've done 2 now. We're going to do a 3rd one, May 14th. Join us, where I have my guitar and I'm strumming along and I do many songs and people sing along. What's sort of funny, it's not quite a sing-along because we mute everybody, because otherwise all the delays of all the computers, it would be a mess to have everybody really singing along. But I sing and people sing along. And yesterday we did Take Me Out to the Ball Game with a handkerchief for 1, 2, 3 strikes, you're out. Baseball hat people were wearing. So I've got the interaction going. I've got the laughter going, the singing going. It's virtual Barbara Lee sing-alongs. It's wonderful. Thank you, Lori.
It's kind of like a sing-alone, sing-along type thing. And it's funny. And some people don't sing, but they're just enjoying the music and bopping their heads. And, it doesn't make any difference what you're doing, as long as you want to be there and you're part of a group. The other thing that, I would just throw in is that people were fascinated that they could do Zoom, so it pulled them into another opportunity to communicate they didn't know existed, and it's safe. So we have the excitement in the room with people, and they want to chat with one another, but we don't really have an opportunity to do that. We let them do it a little bit, but otherwise they start talking over one another, and so we keep fine tuning how we can help that interaction. So we're trying to get people trained now on using the chat box or using the annotations, to wave or clap or say hi. But it'll all take time, and every group is going to be a little bit different, with that. And Barbara Lee also does a nice job calling out on people just to make them feel engaged, and we'll unmute a person at a time so that she can have a little bit of interaction, and yet not too much, so it's not too distracting for the whole group. So, but it is a balancing act. And then I go in and edit it, and we put it out on YouTube. And we had one gentleman, I think it was Tim, whose wife Diane watched it like 29 times in 2 days. And he sent us a picture of her standing before their big screen. And he said, how wonderful, that is for him. Or Jerry, who mentioned her husband, who she said, he just seemed down and sad. And he's like, he went to this and he got happy and he was smiling and he was singing. And she said that made his day, but it made mine too. So it has this ripple effect of going through. And then we've had some that have been with the community, and in their memory care. Some of them aren't in their rooms alone. Some of them are still mingling, and they're very isolated. But they social distance in the community room, and we'll watch this too, if not live later. So lots of neat ways to be able to connect with people that everyone's learning to use. And I think it's fabulous. So thank you for sharing that with us, Barbara Lee. Anything else that you wanted to add that we missed?
No, not really.
Okay. Cathy, I'm going to go to you next. And I'm just interested in, you were on the show once before and had talked about, starting a support group. You were really interested in trying to do the virtual support group. So maybe tell people how you interacted before and what you're doing next.
Sure. So before COVID-19, most of my work was based on traveling to facilities and training professional and family caregivers. And that has come to a screeching halt because they're not allowing anyone to come in and visit into nursing homes, let alone do any training or anybody outside of the essential workers in there. So that's kind of stopped. The other really interesting part of it is that I'm still in talks with a lot of people who want to have the training, but a lot of upper management in long-term care facilities are looking at what staff do they have left? Do they have the ability and the time to pull them away to do training, because the need is so high for that one-on-one contact and that care? And they're also asking themselves, and then out loud asking me, we really don't know what our staffing is going to even look like in a couple months. So as much as we'd love to have your services, we don't know what our funding is going to look like. We don't know what our staffing is going to look like. So it's definitely thrown what I do into some turmoil in waiting to see how the dust settles. So in the interim, as I'm in isolation myself, because we're choosing to self-isolate as a family. My daughter has a severe heart condition and none of us want to get her sick. So we have been self-isolating since the middle of March. I counted the days today. We're on day 39 and I'm going to lose my mind. But one of the things I wanted to do is I still need to be in touch with people. This is a passion of mine. When I can start to talk to people and have them share their experience and virtually hold their hand, listen to their story, maybe give some kind words of advice that are needed or asked for, it fills me up. I will definitely say it fills me up. So one of the things I've wanted to do is provide a virtual support group for people. It's very difficult to do, I have found, and I am struggling right now. I've been running it for a month and I've had very little interaction. And I'm not quite sure why, and it's something I'm taking, and I'm not taking it as a loss on my part, but more of a learning experience. Is it that it's called a support group? Because that's what people are struggling with. Is it that it's on Zoom? And like you said, people are just starting to now learn that there's these other ways of socializing and meeting face-to-face and having conversations. I think one of the biggest obstacles I find is that I cannot right now find that intersection of people who know caregivers in need and get them that information. So sometimes the best people to talk to in this stage of the game right now are people who are still essential workers delivering durable medical equipment. They're still coming into people's homes. They probably are there weekly delivering equipment. They know families intimately. They know caregivers that are in need. But I can't go to those durable medical equipment offices right now because of the lockdown. So I'm having a hard time meeting in that intersection. But I'm going to keep the training or the support group going. I'm going to keep running it. And one of the things that I found, and this is where my age meets with my children, my 19-year-old has helped me figure out how to use Reddit, which is not a social media platform I have ever used before. I actually try to avoid social media platforms as much as possible because they can really make me feel pretty down, or I become really sucked into them. Either way, I don't like the way I feel. But Reddit has been interesting because I have found that there's a very big subgroup of people who are just, they're stuck at home, they're looking for help. So it has been a blessing for me that my son has helped me, that every day I go onto Reddit and I see people's posts, they're actually asking questions and they're asking for advice. And when they ask for the help, I love to give it. So every day I try to reach out to as many of those posts as possible, provide some assistance, and I'm pushing out there on Reddit what the support group is, when it's available, how they can get onto Zoom, trying to make it as easy as I can for people. So it's still work in progress. I'm still gathering as much information as I can because it does not take off as much as I can tell it is needed. It's a really good just study point as to what is it about support groups themselves where we really do benefit from them. But when it comes to the day that it happens, we find something else we'd rather do. So I just find that to be pretty interesting because when we walk away from it after we've engaged in it, we all feel much better. So there's some kind of sticking point to it. But I find all of those kinds of things interesting, and I just want to keep pushing out that I'm here to help people. I'm here to listen. I'm here to give advice. I'm here to just let you vent, whatever it might be. It's going to help you, and believe me, it fills me up too because this is my passion.
Have you thought about, are you targeting just caregivers, or have you thought of doing like a memory cafe at all? Because part of the problem that you identified is letting people know that you exist. And with the memory cafes, there's the memorycafedirectory.com, and that's groups for people with dementia and their care partners both. And what happens there is Dave is now listing the groups that are virtual. So he gets a lot of traffic, and there's not a ton of them that they're kind of in the process of now switching to being virtual. Like I've got a virtual group. To be honest, I've only had one person that's called that said they want to join it, but it would be an avenue to get your group out there.
Right.
Getting a hold of even aging services in your area. They're pushing stuff out, letting the Alzheimer's Association know, Alzheimer's Foundation. But to me, one of the biggest problems out there right now, and I'm hearing this from people with dementia and their families both, is they're saying there's so much out here, and we don't even know where it all is, but we get overwhelmed on even what to choose to go to, what to pick. And so that makes it really difficult too. The other thing might be of interest too is even if you have a list of people who have bought your book, might be interested if you did a mailer, to them. I don't know if you do a newsletter or shout out, or maybe they just follow you on Facebook. But it is difficult, and that's, I guess, one of the reasons I've been fighting for the creation of a resource directory. Mm-hmm. It's just asinine. We don't have one for events. We don't have one for just general information. Everybody's, picking and choosing from so many different sites, and it gets overwhelming. It gets exhausting for people. I like what you're doing with Reddit though. I think that makes a ton of sense. With that.
Yeah, and I think on a personal level, the way COVID-19 has affected the professional in the house, and I'm sure everybody who's working from home is feeling the same thing. I have 3 kids and a husband. We're all in here together, and it's a little overwhelming. Mm-hmm. I have found that I have to be everything to everybody. And on a personal level, that can be really hard. Not only am I having my own memory issues that I struggle with every day, but my structure and what I'm used to has completely shifted. And what my family was going out in the world and getting, they now are looking inwards to get. And it's becoming very overwhelming. So I'm listening to everything you're saying. I'm taking notes as you write them down, as I'm writing them down as you speak. But as soon as I get off this call, I know my son is going to want to work on a puzzle we've been working on. My daughter and I have been trying to exercise. My husband wants, I'm his new therapist, as you will. So it's almost as if we have way more time because we're in the house, and yet I feel like I have so much less structured time to do the right work. So I appreciate everything that you're telling me. I'm going to do the absolute best I can to reach out to these because I do want to reach people. But on my own working this, it has become a little bit harder than I thought it would be. You'd think that a day off and every day is a Saturday, essentially, you'd have tons of time to get this done. And I feel like I almost have less time in some ways.
Yeah, no, I understand that. Tree, you had a question?
I don't know if I've ever heard of Reddit, Cathy. Can you tell me what it is?
To be honest, I could pull my son out. He just walked by. Quite honestly, I'm not sure. It seems to be a social media, and I could be so wrong. It seems to be a social media platform where you put in what you're interested in, and that is the feed of information that you get. So when my son set me up for it, he said, okay, Mom, let's start with cute animals. So I literally follow and only get posts about 2 different topics, cute animals and dementia. That's it, which I like because for me, it filters out all the other junk that I don't want to get sucked into.
Yeah.
It's not like a Twitter feed where you're getting news and you're getting celebrity stuff and then people and it's too much for me.
Yeah.
So for me, you pick what you want to see or read about. You can make comments. You can read people's comments. You can, if you see a comment that you like, you give it a thumbs up or an arrows up going, you got an up boost. Not quite sure how all the real technicalities work. I call my son Jack my Reddit manager, quite honestly. But I have found it to works for me because it is a filter I can choose.
So when you say you kind of set up a support system in there, people.
So what I've done on Reddit is post that I have a support group. I've let people know in my platform what my background is so that if they ask for advice and they're getting it from me, they can look back at my platform and go, oh, she probably knows a little bit of what she's talking about. She's done this for a long time. And they can see that I'm maybe different from a caregiver who's only done this with their mom. And that person's going to have a very different outcome, some really good, different concepts and ideas. So it's nice to see the balance in that. So what I've been doing is putting the information out on Reddit. I have put it out on Facebook. I have not put it out on Instagram. And I'm going to be completely honest with you. I made a New Year's resolution that I was going to stay off of social media this year. And I have successfully done it. I have stayed off Facebook and Instagram up until now, other than the one post about the support group, which I'm sure Lori is like cringing. She's like, no, you got to put it out there. You have to put it out on Facebook. What are you doing? It's just, I know from my own mental abilities and what I can keep going on and what pulls me away and confuses me. If I get too much information in, I don't know how to sort it all out. So Reddit to me has worked so far. And I like it because people are asking for input and they're asking for advice, which I'm really good at giving. And Facebook, sometimes people just post things and they're not really looking for you to give your advice. In fact, they're kind of like not interested in that at all. So that's just a platform I have found that's, browse it, take a look at it. It's kind of worth it, I think.
Yeah, I will, because I'm trying to figure out, well, if I wanted to see something you post in there, you've got animals, and what's the other category?
Animals and dementia. That's it.
But dementia, both such deep topics.
Well, we just started with animals because he wanted to show me how it looked, how pictures would pop up and how you can go, oh, that's really cute. He just kind of wanted to give me a tutorial. So we started with something very neutral, but he knew my goal was dementia.
Okay, I'm just wondering how people could find you on there.
As we continue to talk, I will look up and figure out how you can find me on there.
Okay. All right.
Okay.
Good.
Sounds good. One other comment I just wanted to make, Cathy, about what you're doing is, you had said, is it the word support group? And I think that does have a lot to do with it when I was caring for my own mom. And granted, I had a lot of background, not necessarily initially, but after a while, I mean, I ended up having a lot of knowledge and talking to a lot of people. And I just thought, oh, that's not another, and this is how I thought of it in my head, you know, which was probably wrong, but was my thought process. I can't add one more thing to my list to do for my mom. I didn't see it for me because everything I was doing was for somebody else. And I didn't really understand what it was. And I actually fell into a support group on an accident. I went to a support group to see somebody speak. He was sick and didn't show up. I felt like, well, I can't really leave, so I guess I'm going to stick around. And then it was like, oh my God, this was really helpful. It was nice hearing other people's stories. But I think people feel like a support group means for many that, you know, you're not strong enough to handle it on your own. And, you know, there's some negative connotations to that. And so like, even with the Memory Cafe, when I talk about it as a gathering. I say it's really like a group of friends. You don't show up with an agenda for a group of friends. You just go where you need to go, you know, to support one another. And, but again, some memory cafes are very structured and do educational pieces. Some do music pieces. Some split the people into two different groups. So people with dementia go one way and the caregivers go another at maybe the second half of the program. But that is something you could also do within Zoom because there are breakout rooms. Mm-hmm. Could separate people and have conversations and then come back to do that. So that's just another thought, I think, wording. And then the last comment I was going to have that might be helpful. I don't know if you are comfortable on LinkedIn, but if you push out what you're doing there, you could be getting in some of those, critical, essential workers, letting them know. The barrier that I have found is that many of the organizations are so overwhelmed with the PPE and direct cares that they can't even think outside the box.
I can't agree with you more. I mean, I think, first of all, yeah, language is huge. And when you say support group, it does have that negative connotation that, dementia unit, the word dementia unit, my mom lives on a dementia unit, or nursing home. It does carry that negative connotation. I agree with you. And I just wrote down a couple words as you were speaking, a caregiver rally, just by changing the words, the language, it provokes perhaps more interest and not a focus of, oh, this isn't something I can handle. I can't take this on. I totally agree. Yes, I've made posts on LinkedIn, and interestingly enough, I've gotten a lot of comments about how this is such a great idea, and yet nobody is really, I don't see anybody from LinkedIn joining those groups. However, though, I have seen more traction through Reddit, surprisingly enough, and I'm surprised about that. And it is what you're saying. I mean, they are so overwhelmed with, do we have the right equipment? Do we have enough beds? Do we have enough of the really essential care? And yet it is these caregivers that are going to burn out so incredibly fast, the professionals and the caregiver and the family who can't do anything. They're paralyzed to want to help and they can't. They have to, wave to mom from the window. The stress of that is weighing on so many people. I'm sure all of you heard about the doctor who took her own life because this is so mentally taxing and we're not paying attention to that. And I think you and I had a conversation a couple weeks ago about exactly that. This is way more mentally taxing than any of us are giving credit to. And groups, rallies, whatever, like you're saying, Memory Cafe, I love the terminology of that. It will and should be available and could help. It's just like you said, it's getting that message out there.
Yeah. The only thing I'd worry about using the word rally is that it could turn like political and motivating. Yeah. Not that that's not a good thing or a bad thing, but just making sure what the focus is, because there are a lot of people upset that, healthcare, that government is not paying enough attention and giving enough equipment and funding to nursing homes, assisted living stuff there. And so rally could turn into something big. That's just my thought. Last comment would be, have you made a flyer so that you could post that on LinkedIn or Reddit so that people could download a PDF and then share it. Then they have
I
something
have not.
solid.
Okay, I have not. Thank you for that.
Yep, that might be helpful as well. But I like the idea of even developing like a hashtag or something, you know, for you that's catchy. I don't know exactly what that would be, but that might, and I haven't done the whole, I do the hashtag thing when I'm in LinkedIn, and I'll put in keywords and stuff, but I haven't made a personal hashtag. But you know, so it could really go either way on that. So thank you.
Okay, thank you
for sharing all that. Tree, why don't you talk about what you've been up to and some of your experiences and goals through this COVID time period?
Oh, well, let's see. I have a friend at a memory care center, as I told you about, that I'd go see very regular. And when the COVID, I think it was like the first week or two of March when it was getting a little hotter. CDC said if you are over 60 and if you are high risk, you shouldn't be going out. Well, I was a double winner there because I have a compromised immune from a bone marrow disorder, and I'm over 60. So I had to stop, and actually the day after I stopped going there, the memory care center had to quarantine because of illness. Someone had gotten ill in one of their homes. So then I heard that none of the residents there could have family members or friends go see them. And every time I've been there, it's just full of family. You know, it's everyone goes there, and not just, you know, friends, and there's volunteers. And the thought of these wonderful people not having people there to visit them, and a lot of them in the beginning had to stay in their room and couldn't even eat together. And then they start eating together, you know, sitting them far apart, because I'd call and ask the director. And it just really was upsetting to me a lot. So I had an idea to maybe get pen pals for the residents. And so I sent a letter. Well, first I called the director of the home and I asked her what she thought about it, and she liked the idea. And then I got the, you know, the names. I mean, I knew everyone's names from just going there for so long. And then I asked the director for maybe some personal points about each person, like what did they like? Now, certainly a lot of people are at a level with Alzheimer's where they're, you know, like if they love something or a hobby and they haven't done it for years, you know, that, you know, but the director would share what she knew about people. So I wrote a letter and I put everyone's first name on it, what they liked, and I sent it to a group of friends. And I asked if anyone would like to be a pen pal to an elder during this time. And I'm telling you, within a couple of hours, I got so many people writing back wanting to do that. And so some of them, there's like 22 residents, and I think I got a couple people wrote and said, if I don't get enough volunteers, they know people that might like to do this too. But I did get enough. Some people have more than one and are like it that way. And I've gone there for a while, so I know the personalities of people, and I write to several of the elders every week. And it's been part of my being in quarantine. It's really been good for me. I don't get to go to the store and buy cards. I had to order stamps from the post office. I make cards, so it takes me hours every week because I make the cards. I have a box of old cards, and I'll cut out things that I think someone might like. But I know the personalities of the people. So my friends that are writing to them, when I talk to them, they tell me, like I say, oh, maybe so-and-so likes crafts. Well, some of them have told me they've written like deep letters and told them all about themselves and their family. And some just say they just will put short sentences. And as we're going, we're learning how to do it. I talked to the director recently and asked her how the letters thing's going. And she says she thinks shorter letters might work better. And so I know I've been doing that because I just know from my experience that would be better. So I'm sharing that with people. And I actually, I don't know, I really have fun with it. So I put, because I little inside jokes of people I've gotten to know. And so that has been a way of staying connected. And I know it's not nothing for them who've had family members and people going there. But my thought is there's someone, once a week reaching out to them and talking to them and sending them something. So that's just a little something different in their lives. And then another thing I've done there is, Barbara Lee, you talk about music, and over the years, Lori always shared how much music affected people with Alzheimer's, and I've watched television shows that were amazing to me, like people that didn't talk ever, they always sing when there's music, or they dance, and when that's over, they go back to maybe being inactive and not talking. And so I kind of formed a little choir, and I put music together, and we'd sing songs, and it is like what you've all said. It's just been marvelous. And I remember there's this one person that when we would get together and sing, we go choir practice. And when they come together, there's one gentleman there that would always hold his head like he didn't ever want to come in the circle, and he'd go, oh, I don't want to do this. And it's I've gotten to know he's a tease, and it's his personality. I always kind of thought it bothered him, but he'd never leave the room. And then his wife came to see him one day, and I always call him Sunshine and sing him, You Are My Sunshine, because he does everything opposite of Sunshine. And he just goes like this. But his wife says it's his favorite song. And so when I found that out, now I'll sing it to him whenever, and I'll just drop him a card and say, hey, Sunshine, how's it going? And I know he'll just know who it is because of that. But so I don't know. They're very simple things what I'm doing. It's just a little way of connecting with people there. And I try to think of other ways. Like when I was on your sing-along yesterday, Barbara Lee, and thank you, Lori, for Zooming it all. When I was on that, I was thinking a lot of the people that when we'd sing, they didn't remember the song. So I asked Lori, is there a way to put the words up? And she's, there isn't on Zoom. But what would be cool is if there was a place to access the words, and the nursing home could print them out, and you could have a Zoom on the TV with you singing, and people could have the music there. Because that's what they do with the little choir I put together. They printed music, I type up the words, and I learned a lesson, type them big, because their eyes aren't so good. But so my head kind of starts going like that. How can you do this? How can you get them? I don't know. It just, to me, it's great. It's just great that all the different things that you can do with them. So my head's constantly moving like that. And I love this challenge in this time. So I think that's what, Lori, you're kind of doing here. You're sharing ideas with people, and that goes out to some, so maybe others will pick up from different ideas. Yeah. So I guess that's all I'm doing. And I call people and talk to them.
But those are, when you say, oh, that's all I'm doing, those are huge things. Those are huge, huge things.
Oh, yeah. Well, they are for me, too. I'll tell you, I really have enjoyed it a lot. I've really, and my friends that are doing it have said, like, if I do talk to them and a couple weeks later I talk to them again, they'll tell me. And one of them said to me, I never got a letter back. And I thought that was pretty interesting. I says, I said, it's a memory home, so it's people that have more progressive memory problems. And I go, I was surprised how many of them read, and how many of them are reading, because I thought maybe some of them lost that skill, but most of them could read well. And so I thought, no, my head's been going on that, and I thought, well, it's just because they don't have the resources. Maybe some can't, like my friend can't write anymore. But if I put in my letter an envelope, a self-addressed envelope with a stamp and a piece of paper, and said, drop me a line, that the staff would probably help them, and it's all right there. So that's what I'm going to tell my friends, to open the door, to make it a two-way thing now. And then they're acting more with the community, interacting more. So
yeah, that's a great idea. And they're, everybody's a little bit different, so you kind of got to find that out as you go in terms of
right.
In terms of communication. Because even, there are some people with dementia that say, I can't use the phone. I can Zoom, but I can't follow a conversation, or I need to be able to read the nonverbals and read the lips of somebody. And
that's a really good point.
Yeah. So everyone is a little bit different. But reading, I know for my own mom, she really took pride in that, and she followed her reading routine even when she lost the ability to read. She still wanted a newspaper every morning, and she would sit and she'd look at it.
Yes.
She couldn't read anymore. And I didn't realize that until one day she was sitting with the newspaper upside down, pretending she was reading.
Yeah, I've seen some of the residents do that.
Yep. And so those habits are really important. And so, I just approached her and said, "Oh, Ma, there's something on the back. Do you mind if I just look at that quick?" And then I was able to flip it the right way and give it back to her, to hold. And, my brothers were like, "Well, she doesn't need the paper then. She can't read." And I'm like, this is like taking somebody's car away. This is a really important piece of who they are.
Yeah.
The dignity thing. And so, all those things are important. Now, you already had a contact with the community because you were working with your friend Ann there. Have you reached out to other communities as well, or what would you suggest if people wanted to try something like this?
Well, the first thing I do, if someone has a friend or a family member even in a home, I would suggest that if it's something that they think they have the time to undertake, 'cause it didn't take that much of my time, honestly. And every week when I put a couple hours into the letters, that's because I'm having fun doing arts, making the cards and stuff. But I would suggest calling the director of the home, asking them their idea, maybe sending, if they're up for it, sending a list of names and interests they have. And then just, sending it out to, writing to a group of their friends and saying, "Would you like to do this?" Because it is making us aware. Like, it's interesting to me at the same time that the post office is challenged. They're both picking up more work, and they've lost a lot. Like, they've lost all the advertising that was run through them for businesses that are no longer open. That was a big part of their budget. But they're picking up more mail, and they're having a lot of problems. So I've listened to some programs on it, and I thought, well, the mail can't go away, for a certain part of the community that doesn't use computers, which is maybe older people, probably no young people, they all have phones, but there still are a lot of people that like that. And I think just starting something like this, and Lori, it would be good to put it on something like Reddit, maybe.
My son, who's 19, he's my oldest, is home from work, obviously bored out of his mind. And he used to come to all the different facilities that I would work at and loved talking to the older adults. And specifically, he seemed to gravitate to the veterans, loved talking about their war stories. And I was going to ask you, how can I connect him with you so that he could become either, as Lori mentioned, a pen pal or even a phone call to just engage with the older adults the way that you've set this up? And again, please don't downplay what you're doing. Don't say I'm not doing much. You are doing a ton. You are doing so much.
Thank you. Thank you. Well, what I think of right away is, the thought had occurred to me a while back that I wonder if this is going on at all the nursing homes. And I don't know. And also the fact that they're expecting possible quarantining, maybe to go through summer into the fall, worse in the fall. So how can this happen? And I guess I would just say anyone who's interested in a call. Now, you say your son's interested, maybe, some of the elders who've had military experience. My husband's a vet. I think it'd be great to call the vet's home. We're vets for elders, and ask them, you'd like to do something for the vets while they're there. Because I do know some people just go visit and volunteer a lot, but because they can't have visitors, just maybe to start something like what I'm doing. And if it's in a memory care, they might have a hard time writing back. Mm-hmm. But I do think it's come to me really strong. I do think envelopes with a stamp is going to help people a lot, and even the paper, because we all know our nursing homes don't have the resources, the staffing resources, or so it's really helping out with that. Yeah. I guess I've noticed that going to visit that.
I absolutely love your idea, and I think with memory care, lower your expectations in regards to getting that letter back, but that's not what it's about, and no. I think when you what it's really about, you are reaching out to somebody who is craving a connection in some way. And what you're also doing is you're making the job for the essential workers in that facility, I think, easier, because now they have something concrete that they can read or use to connect with somebody on a one-to-one basis. If they're doing a lot less group activity in that facility, the residents in those homes are isolated in their rooms, or seeing very few people. But to get a letter and have it be read to them, versus having an essential worker or a CNA come in and just be like, I'm sorry, we're not doing Wii Bowling today. You can read your book. And like Lori said, they end up reading it upside down. You're actually giving the essential workers, those CNAs, a tool that they can use, which is phenomenal, because so many of them at this time, all the time, but specifically at this time, are probably just strapped. If they had an easy, simple tool in their hand that they could use to connect with somebody before they had to move on to the next resident that they had to care for, what a gift you are giving that home, that staff. Because right now they can't do bingo. I mean, I've seen things, they're doing it in the hallway and so on, but more than ever, we're doing one-on-one connection, one-on-one interaction, and you are providing them that tool. And I think that is phenomenal. Fantastic.
Thanks. When you said bingo, I tell you, I have so much joy going to see them. It brought up sometimes I play bingo with them. And there was one grandma in there that was really winning a lot one night. She won almost every game. I just couldn't believe it. And every now and then something happened, I go, oh God, we were just laughing so hard. And one of the grandmas said, I think we need to pray. I go, well, what should we pray for? And she was the winner. She goes, I think we really need to pray for all the losers, that maybe they can win something. And I mean, she just said it with such heart. Because they get a piece of candy or something and they win. I'm so sad I can't go visit.
Yeah, you're doing so much right now. I can't, if I were in a facility and I had this supply that you were providing as a tool to use, I cannot tell you how useful that would be.
Yeah. But when I talk to my friends, some of them find it easier to do and some don't. And I think it's because, like, for me, I've met the people, and some just write and if they go with what that person knows, and some aren't getting any feedback, so they're not sure they're having an impact. So that's where my mind is thinking about now. How can it be improved upon for a two-way? So I think the self-addressed envelope, and I do think that does pick up the two-way street there too.
Yeah. So that's really nice.
I mean, people like Lori, maybe your mom, did she talk?
Well, she lived with him for 30 years. So depending on
at a certain point she did.
Yeah.
Certainly you could see if someone wrote her a letter that maybe they'd help. She'd have some thoughts, and then a companion or a caretaker there would help them out.
But that's the problem right now, is having the staff have the time to help write the letter,
what about a form letter? Something along the lines of, if you're including a self-addressed stamped envelope, in this already, so you're easing that burden already. What about something fun like an ad lib, where you come up with a form letter and, hi, my name is blank, and my favorite blah is, and one of the things I enjoyed is, and so you're giving the essential one-on-one caregiver questions to ask to engage someone that is still verbal, but they don't have to write it out in a letter form. They're kind of just filling in the blanks a little bit. Maybe that could simplify the process and maybe bring you a little bit closer to getting a response. Just a thought.
No, I think that's a great idea, because there's just, there's some people that just don't talk at all, but that would really help the interaction with the staff. And then there's some that do have a lot to say, right. So even just a blank letter would get them. So it could be geared towards what they know. Yeah. And it could be something that could go on after COVID.
And it should.
And it might be something where you send kind of the fill in the blanks, so you're modeling what it is, and then you could say, turn over, I got a note for you on the backside. So if people wanted to write a note on the backside, they can see that they could fill this out, send it back in the envelope as well, just so that that they received it too. Because there's that question: did the mail get through? You know, it's important, you know, Barbara Lee, even with singing, you said it's hard to sing and not hear applause. I mean, you can kind of see things on the screen and stuff. But all of those things, you know, make a difference to everybody. Or the people in the sing-along say, well, we'd really like to hear everybody sing. Well, we could, but it's going to be a disaster. And for people with dementia, it's going to be horrible because it's going to be really mumble jumble. So it doesn't make sense. One thing I was thinking when you were talking about your son was, how cool would it be is if communities had those little computers, that little robots that went down the hall, and your son could be on their conversation, people could have conversations, and this robot just goes down the hall and keeps talking to people.
Yes.
But it's
yes.
a live person on the screen, you know, on
Right.
an iPad. And
Mhm.
they don't have to fart with technology. They just have to come by the door or sit by the door to engage.
Okay, yeah. Tree, now, does the memory care place that you do this at close to where you live or not?
It's about 13 miles away.
Okay, because do you have time to do this at another home?
Oh, I think I could probably, yeah.
Because,
I'd have to, but the thing is, Barbara,
yeah,
I sent out letters to my friends, and they're writing now, so I could say, does anyone want, you know what I mean? I have the same group of friends I'd be sending out to.
right,
So it's
right.
a matter of getting more people involved, and maybe they can write to their friends.
I could see you doing, I mean, this is really brilliant. And, you know, I don't want you, like Cathy said, to minimize
Yeah.
what you're doing here. This is absolutely brilliant. And ideally, I could see you doing this at more homes, or right now even taking a look at one more place, you know,
Yeah.
and maybe one that's closer to you. So when the COVID is over, you could go visit a little easier. I don't know. Just be sure to not minimize what you're doing.
Thank you. I won't. Thank you. I
And-
will not.
And second of all, I could see you expanding it.
Well, I'm already thinking of, you know, oh, maybe I'll talk to Cathy's son and and have a little conversation with him about like the vet's home. Because a couple of the volunteer writers are saying, well, it'd be nice one day to meet them. And I'm thinking that'd be a cool thing, you know,
Wow.
because it's a one-on-one. Like I will go to see my friend and all of a sudden I know everyone at the nursing home. You know what I mean?
Yeah.
I keep calling it a nursing home, but it's memory care. But you just kind of get to know people. There was once where I couldn't go there for about a month. And there was a resident there who he never would say hello to me no matter what I do. I'd like, you know, and one of these days you're going to talk to me. And he'd just sit there and stare. And I knew he was there. And after a month when I came back and I walked in the door, he's like, hello. And I'm like going, I knew it was in there. They're just great.
You know, one of the things too, Tree, and you know, if you've got a relationship with the community, if they would allow you to even call families and say, this is what we're doing, because there's a lot of families that would probably help join in doing this. But again, they need
a great idea, Lori.
They need a starting point, and that's where you know, these communities, they've got to. I know they're stressed, but they really have to stop and tap into the resources. They are there, but they have to ask. They have to ask. And I know a lot of them don't have like a volunteer coordinator, and they're all worried about process and liability, which they should be. But again, this is an emergency situation. This is a mental health and a physical health thing, not just for their residents, but for their staff and for their families.
Yeah.
And there are a lot of people that are willing to help, but they need a coordinated effort, you know, to do that. And so, you know, if you can, you know, if they can trust an outside person enough, because those names are precious, you know, but they could even send, you could even make a email for them to send out to families. Would you be interested in talking? We have someone who's coordinating this. They could send it out and then not give you everybody's name. That would be another thing. But I think we have to think of ways to reduce their work, and they just have to really, you know, copy and paste and push a button.
Yeah, that's a really good suggestion, Lori. a really good suggestion, I think.
We should probably wrap up here. Barbara Lee, any last comments from you?
Oh, you know, the more I listen to you guys talk about your passion, the more I miss my passion of being in the sites that I go to. But this is where this Zoom sing-along idea, I think, is going to come in handy. Right now, we're starting to do it twice a month, to every other week. And I don't know, maybe I want to do it once a week. I don't know. But especially if this thing continues on through the summer and fall. Yeah. Oh my gosh. So, Lori, I want to thank you again for giving me the opportunity to start doing Zoom sing-alongs, though. It's just a great idea. I really am enjoying a Zoom sing-along.
Barbara, if you want to give people your contact information.
Sure, I'd like to give you my website, which is musicmemoriesmin.com. musicmemoriesmin.com. And if you want to email me, it's Barbara Lee at musicmemoriesmin.com.
And Cathy, how about you? What contact information would you like people to have?
The website is dementiaraw.net. My email is silverdawn.info, SILVER, dawn, info@gmail.com.
The one I'm going to give you is Trescia, TRESCIA, at Blessences, BLESSENCES.com.
So they can get you, they can go to blessences.com.
You can have my blog.
Well, thank you guys for your time today. It was an interesting conversation. Thank you. Bye-bye.
Thank you. Bye-bye.
Thanks, Lori.